Clinics can apply by completing the official application form available on the EFS website in the member account. Once submitted, EFS certification team will contact the clinic to initiate the process. Yes, an online application form is provided on the EFS website in the member account. All required documentation can be uploaded through the secure portal. Yes, PCCCP is open to clinics globally. While it's developed in Europe, its standards are internationally relevant. Clinics must be operational for at least 12 months and actively providing fertility care services. They should also demonstrate a commitment to patient-centered practices. The applying organization, fertility clinic or hospital must confirm that it operates in accordance with the following eligible criteria: a documented patient care policy, an internationally recognized code of ethics such as the WMA International Code of Medical Ethics, and a quality management system such as the ISO 9000 standards of the International Organization for Standardization or a similar internal or externally certified QMS. Each clinic location must apply separately to ensure a site-specific assessment of patient care practices. The full process typically takes between 2 to 6 weeks, depending on how promptly the clinic submits the required documents, attends the assessment interview, and responds to assessor queries. Applications are accepted on a rolling basis throughout the year. In exceptional circumstances, expedited reviews or pause may be considered. Please contact the EFS Central Office team directly to discuss options. Clinics are required to submit internal policies, patient communication materials, consent forms, staff training protocols, patient feedback summaries, and other documents reflecting their care standards. Yes, a detailed document checklist list of evidence is provided to the applicant to guide the clinic through the process. EFS doesn't share any examples with applicants. However, the EFS provides patient-centered care guidance to help clinics to prepare and structure their submissions effectively. Submissions in English are preferred. If materials are in another language, EFS may request translations of key documents. Absolutely. Patient feedback, service, and testimonials are strongly encouraged and valued in the assessment. Yes, each clinic is assigned a certification coordinator who serves as the main point of contact throughout the assessment. Yes, introductory consultations are available to help clinics understand the process and decide whether to proceed. Yes, support materials including webinars, videos, and fertility patient care guidance are available for all applicants. Yes, clinics can contact the certification team via email or schedule video calls to resolve questions during the process. Assessments are conducted by an independent certified assessor under the supervision of the EFS Certification Committee. Currently, the process is fully remote and is based on an online application, the documentation provided, and a virtual assessment interview. Additional evidence may be required if clarification is needed. Evaluation is based on alignment with the PCCCP guidelines, covering categories such as trustful communication, patient-centered facilities, emotional support, diversity, qualified team, and positive experience. Yes, a comprehensive feedback final assessment report is provided whether the certification is granted or not, including strengths and areas for improvement. Total fee is £3,000 regardless the clinic size or location. Bank transfers are accepted. Payment instructions are provided with the invoice. The full payment is required based on the invoice at the beginning before the start of the certification process. EFS may consider reduced fees for academic or non-profit fertility clinics. These are reviewed on a case-by-case basis. The certificate is valid for 1 year. Renewal involves a reassessment process, including updated documentation and additional assessment interview. Yes, the certificate can be suspended or revoked if a clinic fails to meet the ongoing requirements or if complaints are substantiated. Yes, all certified clinics are featured on the EFS website, partners' websites, and in relevant public materials. Yes, certified clinics receive a digital certificate and certification badge, and are encouraged to use it on their websites, brochures, and communications. Yes, EFS promotes certified clinics on social media and almost 20 fertility websites.